How do we understand how this is impacting a person's health, and what do we do about it? And that's where the AI comes in. And the good news about the microbiome is that we can change the person's gut microbiome through these different lifestyle interventions. People have a concept that probiotics are always good for somebody, and that, at worst, they don't do anything, but they can't hurt.
This is the Transformational Life Consulting Podcast with Deepa, Grandon, MD, where Christians like you get the practical support and tools you need to build your spiritual, mental, and physical well-being, and to guide you on your journey to health and wholeness based on evidence-based science and God's Word. I am your host, Dr. Deepa Grandon. Welcome back to another episode of Time to Transform, and a warm welcome to our first-time listeners. In today's podcast, I am going to be discussing a topic that's very near and dear to my heart. As a practicing board-certified allergist, immunologist, and lifestyle medicine physician, I'm passionate about how the microbiome influences allergic and immune-mediated diseases. We now know that the microbes living within us play a significant role in asthma, eczema, food allergies, autoimmune disease, chronic inflammation. But the microbiome is super complex, and that's where artificial intelligence, or AI, is transforming our understanding. AI can analyze massive amounts of sequencing data to identify which microbes support immune tolerance and which ones drive inflammation, while also pinpointing lifestyle factors like diet, movement, sleep, stress, environment, and can meaningfully shift the microbiome towards better health. So in my own practice, I've seen patients of whether it was asthma, EOE, and specifically more recently with asthma, I've had patients who began, say, regular exercise routine and experienced measurable improvements in their symptoms and airway inflammation. What's especially fascinating is that research shows exercise increases levels of Akkermansia, which is a beneficial bacterium with very powerful anti-inflammatory properties. So when I started to see this connection unfold, like between movement, microbes, meaningful improvement in asthma, this really deepened my commitment to understanding how lifestyle shapes the microbiome and in turn the immune system. So I am super excited and thrilled to welcome Dr. Leo Grady. He is an internationally recognized leader in artificial intelligence and the CEO and founder of Jona. He is he created Jona, which is a health technology company transforming how we understand the gut microbiome. Dr. Grady has spent his career at the forefront of medical AI, from pioneering machine learning solutions in radiology and pathology to now leading one of the most innovative platforms in microbiome science. His work leverages deep sequencing, computational biology, and advanced AI models to decode the gut as a dynamic immune organ, one that profoundly influences allergy risk, inflammation, metabolic health, and overall wellness. So in this episode, we will explore how AI is revolutionizing our ability to map the microbiome, personalized lifestyle interventions, and prevent disease long before symptoms appear. So I'm truly excited to have this conversation, to understand from Dr. Grady's perspective the intersection of immune science, prevention, and the future of personalized medicine. Dr. Grady, thank you so much for taking the time to be part of this podcast. It's truly an honor to have you with us today. So before we begin, can you share a little bit about your background? We were talking even before we started recording this podcast, and a large number of my listeners are Christian, and you have a special story to share with us as to how you came up with the name Jona for your company. So can you tell us a little bit about that?
Well, it's great to be here. Thank you so much for having me. So by way of background, I did a PhD in AI over 20 years ago. I've spent my career in healthcare, building AI for radiology, AI for cardiology, AI for pathology. And I wrote a couple books on AI and published a lot over the years on it. But a number of my family members have Crohn's disease, colitis, celiac. My son has gut issues. And what I saw with all of them is that they really struggled to figure out lifestyle interventions that could really benefit them. They might try one drug or one particular intervention, but they've really found that diet, lifestyle, supplements could make a big difference for them. But they really had very little guidance on how to do that in any kind of rigorous or evidence-backed way. And in addition, all of the science pointed back to the gut microbiome as really potentially the origin of some of these conditions, or at least mediating how they express themselves. And as I read more and more about the gut microbiome, to your point, it seems connected to everything. Every aspect of our health has been linked with the gut microbiome. Everything from obviously GI issues, autoimmune conditions, skin disease, mental health, Parkinson's, Alzheimer's, even athletic performance, chronic pain, and even cancer are all linked with the gut microbiome. And so it seemed to me that this was the greatest untapped potential in health and medicine. But to your point, the gut microbiome is extraordinarily complex. And this is why I felt that AI was going to be the key technology to enable us to unlock that potential, and then also figure out how to incorporate lifestyle and in the future medications into manipulating and improving a person's gut microbiome. As far as the origin story of the company goes, or of the name, I was inspired by the biblical story of Jonah and the whale. And what was inspiring to me about that story is it's really a story of transformation, right? You have Jonah, who's sort of running away from his duty, gets swallowed by a whale or a giant fish. And that is a moment of reckoning for him, where he has to face what he didn't want to do. And, by going in the belly, comes out transformed. And I felt that it was a really beautiful metaphor for what we're trying to accomplish, both in terms of enabling people to face up to health issues or health challenges that they want to overcome, as well as providing them the information that they need to potentially affect that transformation themselves. So that was and also going through the belly, of course. So that was the reason that story made such an impression on me when I was starting the company. But we took the H off of the name Jona, just to make the company more modern, more tech focused, and shorter.
Okay. Yeah, that's a really cool story. Thank you for sharing that with us. Yeah, I always look at my being an allergist and now focusing a lot on lifestyle. I couldn't relate more or relate better with your story, because even in my own personal life, being so intentional with lifestyle choices have been so transformative. And that's also the reason why I called my podcast Time to Transform.
Right.
The name of my practice is Transformational Life Consulting. So I have that word transform and everything. So that's interesting. You use the transformational experience that Jona had. So yeah, that's such a neat story. And I could totally see how the microbiome can transform people's life if we knew well how to manipulate or to make it better. So
exactly.
So for listeners who are new to this, what does AI do when it analyzes a microbiome sample, and how is that different from, say, a standard microbiome report?
So there are two elements to separate here. One is how the microbiome gets measured, and the second is how do you analyze all of that data and figure out what to do about it. So in terms of how the microbiome gets analyzed, we use somewhat conventional approaches. We use the latest methodologies and techniques there. But what that entails is a stool sample. It gets sent to the lab. We do deep shotgun metagenomic sequencing on that sample. We identify all of the DNA, and through that DNA, establish the full list of organisms in your gut down to a strain level. And it's not just bacteria, it's fungus, it's viruses, it's archaea. And then that gives you an enormous amount of data, about 8 gigabytes of data, which is equivalent to about 8 high-resolution cardiac CT scans. Yeah. Then there's a question of, okay, now we know what's in the person's gut. What do we do about it? How do we understand how this is impacting a person's health, and what do we do about it? And that's where the AI comes in. So where we started is we built an AI system to read all of the current peer-reviewed literature, which is about 220,000 studies on the microbiome. And then the AI goes through study by study and takes the patterns that were established in that study that have been linked to disease or health and sees if those patterns are existing in the person's gut microbiome test results. And so this is a huge range of different disease patterns and health patterns that have been established in the peer-reviewed literature and spans everything from bloating and fatigue and brain fog all the way to Parkinson's or Crohn's disease or even cancer. Then there's a question of what do you do about it? And to answer that question, our AI also read the interventional literature, how you can change your microbiome with diet, lifestyle, supplements, and medications. And we built a digital twin for your gut, a simulation engine, which allows us to simulate, for example, what happens if you go vegan. We know how going vegan is going to shift your gut microbiome. We can apply that shift digitally and make a virtual vegan you and see whether going vegan is going to reduce those disease patterns or enhance those health patterns. And so digitally, virtually, we can do the same thing with keto and gluten-free and really give you every dietary change, every lifestyle change, every supplement, in the future also every drug, every medication, and really see which combination of these is going to work for you to reduce those disease patterns. We also actually even make that interactive. So if somebody says, hey, the disease patterns I'm most concerned about are bloating and IBS or whatever it is, they can modify the objective and then the AI will re-optimize the set of interventions that will help them best achieve whatever they're trying to achieve, whatever their goals are, in the context of all the known peer-reviewed literature.
Wow, that is amazing.
Thank you.
Yeah, so we're like really honing in and looking at personalized, next level personalized medicine. That's pretty fascinating. So
exactly.
Yeah. So from an allergy and immunology standpoint, what early microbiome signals can AI detect that may predict a patient's risk, say for atopy, eczema, asthma, food allergies, even before the symptoms appear?
As you know, the immune system and the gut are highly intertwined. Something like 70% of all immune cells are in the gut lining. And it seems that the microbiome plays an important role in both training the immune system to figure out what to respond to and what not to respond to, as well as in some cases even triggering an immune response if there's some sort of pathogen that gets introduced into the gut. In addition, there's that crosstalk between the gut microbiome and the immune system that's happening constantly. In addition, if the gut barrier, the mucosal layer that separates the inside of the gut from the bloodstream, if that barrier gets reduced with so-called leaky gut, then you can have organisms that produce metabolites, things like lipopolysaccharides, or even organisms themselves that can slip through the tight junctions in the epithelial cells and in the barrier cells and get into the bloodstream. And that can trigger immune responses as well. And so depending on those organisms, depending on what they produce, that can also trigger different types of immune response. And so what we see in the literature is that almost every immune-related condition has been linked to certain conditions in the gut. certain microbes being overabundant, certain microbes being deficient, some sort of gut barrier compromise. And that really spans the range from, classic autoimmune conditions like, rheumatoid arthritis and Crohn's and colitis, to psoriasis, to eczema, to chronic fatigue syndrome, asthma, food allergies. It's really the entire gamut of autoimmune conditions and immune-related diseases that have been linked with the gut microbiome.
Wow. Can AI distinguish like which microbial pattern truly drives the immune dysregulation, like Th2 versus Th17? You spoke about the barrier dysfunction versus those that are just merely a correlation.
Yeah, this concept of causation versus correlation obviously is incredibly important. And the fact is, in many cases, we don't know the microbiome's causal role in some of these conditions, whether it's just epiphenomenal that we see some sort of organism difference in the gut that is correlated to an autoimmune conditions, or if it's actually causing those conditions. But we do know in many cases that there is a causal role. So, for example, with gut barrier dysfunction, we know that the gram-negative organisms will, not create short-chain fatty acids, which strengthen that mucosal layer. As a result, you start to get more oxygen into the colon. Many of the good bacteria don't like oxygen, and so that can cause them to die off. And you can get this feedback loop where more gut barrier dysfunction causes more of these gram-negative organisms, and there's a real cycle of gut barrier deterioration. And in contrast, you have the opposite when you have gram-positive organisms that are creating short-chain fatty acids like butyrate in particular. They're strengthening the gut barrier, reducing oxygen levels, and really maintaining a healthy gut. So we certainly know the mechanisms in some cases. There have been some studies on microbiome transplants, fecal transplants, that have shown improvement in symptoms. There are a lot of anecdotal studies here, but in many cases we don't fully understand the causality, which organisms are causally related to these conditions and which aren't.
Yeah. I mean, I personally have done a lot of work looking into the short chain fatty acid producing bacteria like the butyrates, the propionates, acetates. And from an immunology perspective, it's really fascinating that the SCFAs are so important for a group of cells that are called your regulatory T cells. They literally cause the transcription factor. So transcription factor is almost like that messaging transcription that's produced in your body that's telling your bone marrow to make a certain population of white cells that cause your gut to be a calm place as opposed to an inflammatory compartment. And the barrier that you're talking about, they literally cause the epithelial tight junction, like where they cause these to be really tight, so there's no leakage happening. It enhances that tight epithelial junction, which makes the barrier very compact. And what I found very fascinating with the SCFAs is they literally stimulate your bone marrow to make these T regulatory cells that are so important for balancing your Th2, Th17, which are very pro-inflammatory. So yeah, I think at least we can look at some of these positive indicators. And we know with SCFAs, taking more of these plant-based diet improves these healthy gut bacteria that actually produce a lot more of these SCFAs. So many people they know the everybody says eat more plant-based foods, eat more vegetables. And I can't tell you how many patients I have with hemorrhoids, chronic constipation. And when I actually talk to them about their diet, they're like, oh, I hate vegetables. I hate fruits. I don't like eating them. And there's your root cause. It's not just about fixing the constipation. It's about the lifestyle. So yeah, that's such an important point you brought up about the SCFAs.
Well, in particular, soluble fiber. Fiber is the other key.
Yeah.
I mean, plants for sure. But getting enough fiber, and particularly soluble fiber, is the prebiotic, the food for these microorganisms to produce more short-chain fatty acids like butyrate, acetate, propionate. So it's really important to make sure that people are striving to get a sufficient amount of fiber as well, for all the reasons you said.
Right. And plants, you get your fiber only from plants, though. There's like no fiber in animal products. Right. And the thing with animal products, you have the saturated fats. And the nice thing about plant-based products, there is no saturated fats, and those prebiotics are so important because that is the food for the healthy gut bacteria, like you were telling us.
If I could I just say another word on the causality question?
Yeah, sure. Go for it.
Even if it turns out that in some conditions the gut microbiome is completely non-causal, it can still be an important marker or a biomarker for different conditions, particularly when you have people with complex conditions. There are a lot of very useful tests that we do in medicine that are non-causal of the thing that they're testing for. And a good example of that is FIT testing for colon cancer, which is looking for blood in the stool. It's a great marker for colon cancer, but it's not causing colon cancer.
Right.
And when you treat colon cancer, you're not treating the bleed, but having that information that there is blood in the stool can help you decide what to do next, whether it's a colonoscopy to actually look for polyps or to look for other explanations for that blood in the stool. Just the fact that it's non-causal doesn't mean it's not useful. It just means that the treatment path is not going to run through whatever that biomarker is. So I think if we just think about the analysis side of what we do at Jona, I think causality doesn't play much of a role in terms of the analysis and saying your microbiome has been linked with chronic fatigue, or it's linked with Hashimoto's, or it's linked with X, Y, or Z. It's only when it comes to the treatment side where it matters. Should we be looking at lifestyle interventions to fix the gut microbiome, or are there other elements in our arsenal that we should be taking to try to get a definitive diagnosis and intervene on this patient?
Yeah, I mean, that's a great point because those are telltale signs. They're almost like footprints where you can say, oh, somebody was here. It's a way of playing detective even, and gives us a good idea what interventions or diagnostic tests and therapeutics. And that's where medicine anyway is headed. We're trying more and more to personalize it. And so knowing which lifestyle, and like you were saying in your introduction, how you try to correlate the condition with the food or exercise or sleep or stress or specific treatment, because lifestyle was never meant to replace therapeutics, but to complement. And sometimes if it's caught early enough, like what you're trying to do, we can do the lifestyle intervention early enough that more hardcore therapeutics would not be necessary.
I think there's also an element not only of that prevention and early detection, but also of management of chronic disease. If I think about these family members I mentioned of Crohn's, colitis, they are often on pharmacological interventions or on some sort of drug. And yet, despite being on that drug, how they choose to eat, lifestyle choices, does make a big difference in their symptoms and progression of the disease. And they don't get any guidance there. And even if you look at something like Crohn's disease, there's a Mediterranean diet, there's a specific carbohydrate diet, there are anti-inflammatory diets. Which one is going to work for a particular individual? It's not at all clear. And what does work may change over time as the disease changes. And so the ability to actually look at somebody's microbiome, even if they are in sort of a disease state and they are getting, medications for it, I think can still provide a personalized guidance on how to make lifestyle choices that are specific to them that can help, potentially mitigate both their symptoms and the progression of their disease.
Yeah, totally. I mean, I have so many patients who are on GLP-1s, they've had gastric bypasses done, and they regain all that weight,
Right.
So you just cannot do therapeutics without the lifestyle interventions. They do go hand in hand, especially if you're looking for long-term success and sustaining the goals that you're trying to achieve. Can AI identify specific microbial strains or metabolites that promote immune tolerance? And how might these insights transform prevention strategies for high risk, say, infants, children, or adults?
Yeah. Well, so what AI can do is, to begin with, is take advantage of all the known science. So insofar as certain microbes have been implicated today, it's unlikely that you're going to be able to read as a physician or as a consumer 220,000 studies on your own. And by the way, every month there are more than 2,000 new studies being published on the microbiome. So your ability to actually even leverage what's already known is extremely limited. Now, over time, especially as we establish more longitudinal samples from individuals where they are, doing an initial analysis, making interventions, measuring their microbiome a second time or a third time or a fourth time, and we see how we start establishing data on how different interventions are changing their microbiome, how certain organisms or certain functions in the gut microbiome are impacting their progression and how things are changing. We start to build up new data, which allows AI to then take these massive amounts of data, which are varying over time, all of the interventions that people are actually doing in real life, and start to look for patterns that can identify potentially new information that's not in the existing scientific literature and really go beyond what we know today.
Yeah, that's I mean, so true. There's so much information. We're living in the day and age of information overload. There's like so much information. It's so hard to keep up. So having AI as one of your tools to help you manage all that information to help people is just simply amazing. So we know that early life exposures, say like diet, diversity, delivery mode, antibiotics, they shape allergic outcomes. How can AI-powered microbiome assessments guide personalized lifestyle intervention to reduce allergic risk across the lifespan?
Yeah, you're absolutely right. So whether a baby is born vaginally or through C-section can impact how their microbiome is seeded. Whether the baby is nursing from their mother or having formula can significantly impact their early gut microbiome as well. And we know that there's evidence, at least in animal models, that things like autism, development severity seem to be linked to early stages of the gut microbiome in the the infant period of the organism. Like I said, those are mostly in animal studies right now, so we don't know how well it translates to humans. But what we can say is that a person's gut microbiome at that infant stage really can shape development after that. I think generally speaking, there are some good practices. As we all know, nursing is ideal with a baby when it can be done. Exposure to fermented foods, to a wide variety of whole foods and healthy foods can really encourage the baby's gut microbiome. Generally speaking, processed and particularly ultra processed foods can be very negative for a person's gut microbiome, both as an adult, but especially as an infant and as a child. So I think it's a very critical period, and trying to be extremely mindful of growing an initial microbiome in that baby up to about age 5, where things tend to stabilize a bit more, can be incredibly important for that child's, allergies as well as their future health. Now, you also mentioned antibiotics. Obviously, antibiotics can be incredible life-saving medicines. In many cases, people have overused antibiotics. I can't tell you how many times I've heard of a kid with a cold and a sniffle where they get prescribed antibiotics, often at the insistence of the parents, because it's viewed that there's no risk to antibiotics. You might as well do it. I mean, the fact is that the number of courses of antibiotics that somebody undergoes in their life has been directly correlated with a variety of different autoimmune conditions, with obesity, and there are many people who we see at Jona who talk about having a severe course of antibiotics, and then their health was never the same after that, and they want to understand what it did to their gut and how that's impacting their health. We hear that story over and over and over. So I'm certainly not against antibiotics. I've used them with my own children. I've used them with myself when necessary. But I think it's important to realize that there are risks with antibiotics, and they should only really be used when needed, and not just with this idea that there is no downside, there's no risk.
Absolutely. I think especially that critical window that you were talking about, whether it's prenatal, newborns, all the way up to a year to 18 months, we see this really critical where you have the alpha diversity, the beta diversity. The beta diversity starts off really broad and then narrows down, and the alpha diversity starts very narrow. And just for those who may not know what alpha and beta diversity is, just talking about comparing microorganism within a specific species or within a body part or site, like say the gut, versus the beta is two different, like one bookshelf versus two bookshelves and the type of books you see.
Right.
Yeah, and the thing about these antibiotics, especially the preterm, premature babies who are given antibiotics, and even moms that have group B strep, that their babies, in order to prevent sepsis, are given these broad spectrum antibiotics, they are at higher risk of developing atopy. And we've seen that over and over in many studies. So that is such a good and important point. And if antibiotics are not necessary, parents really need to be educated on not pushing for the viral infections, which are way more common than bacterial. And especially in the first year of life, it definitely can impact the kid's immune response to its environment. So, in conditions, say like atopic dermatitis, food allergies, chronic rhinitis. So we were talking, and you were actually, talking about, for instance, the blood in the stool for cancer. Are there like microbiome fingerprints that clinicians can use to individualize treatment rather than, just rely on one size fits all approach?
There are. In each of those conditions, there are studies that have compared the gut microbiome of someone with atopic dermatitis to a healthy population, and have noticed, telltale signatures of certain organisms being overabundant in people with atopic dermatitis and other organisms being deficient in that population. And with each of those conditions, there are varying numbers of studies, varying sizes of studies. And so there's different evidence levels for each of those, but there are studies that have established certain telltale signatures there. And the good news about the microbiome is that we can change the person's gut microbiome through these different lifestyle interventions. And so if we know that they need to boost certain organisms or lower other organisms, we often know different ways to do that based on dietary changes, lifestyle, supplements, and so on. So it does provide another interventional vector to address some of these conditions. In terms of how doctors can use it, it's very complicated. It's rarely that there's a single organism that is, linked with atopic dermatitis. It's often, 10 organisms that are too high and 15 organisms that are deficient. And so being able to, and every study may have slightly different findings in those different populations. And so trying to put all of that together is very difficult. And that's really what we've focused on at Jona, is having the AI read all of the studies on, say, atopic dermatitis, and then basically leverage the findings from each of those different studies to analyze a person's gut and say, is this signature here? How much evidence is there? And then whatever elements of that signature they do have, designing a optimal lifestyle intervention strategy that can reduce the bad guys, increase the good guys for that person, for that condition.
Yeah, that definitely is the same thing I've heard from some of the researchers that I've had the opportunity to talk to at the Cleveland Clinic. And they're doing it at the microbial level, because it's just so vast. It's so hard, like going back to that question of causation versus correlation, to say, hey, if you find predominantly this bacteria, then the higher the likelihood, and you can manipulate it to reduce its levels. So I hope one day we reach there. So how accurately can AI detect gut dysbiosis patterns? Like you had previously mentioned, the leaky gut. And we know a lot of that leads to that systemic inflammation, immune hyperactivity. And how actionable are these findings for allergists and lifestyle physicians?
Well, the ability to match what's known in the literature to a person's gut microbiome is very high. So depending on the number of studies that were done, the consistency of those studies, the AI's ability to read that literature, look for those patterns in a person's gut, establish them, identify them, and flag them as a pattern related to some sort of health condition. All of that is very well worked out, and that's really what we focus on at Jona. It took us about 2 years to build a clinical grade AI system that can really do this and to be able to operationalize that data. But we have that technology today, and that's what we offer at Jona. Now, the literature though may be deficient, right? I mean, some of these may not be randomized controlled trials. They may not be in the right population. They may not be representative populations of whoever is taking the test. So it's important that we never treat these signatures, the presence or absence of them, as a diagnosis, because we don't have the kinds of studies that have been powered to answer a diagnostic question for the most part in this world. So I think the best way to think of them is as an association, in the same way that you might associate high blood pressure with heart disease. It may not be causal. Just having high blood pressure doesn't mean that you have heart disease. It doesn't mean that you will ever develop heart disease. Yet we do know that there is a strong link there, and that insofar as you have the ability to lower blood pressure, it may have some benefit on heart disease. And so similarly with the microbiome, we do know that whatever elements that you have in one of these disease signatures, there are ways to change them and to manipulate them. And depending on how causal those particular organisms are, you may or may not see a benefit from it. However, there have been enough studies on enough diseases with microbiome transplants, longitudinal studies, that there seems to be a significant causal role of the microbiome in these different diseases. Whether it's entirely causal or only partially responsible for the onset of these diseases, we don't know. But in most diseases that have been studied, we do have some evidence of causality.
Yeah. And, that goes to my next question, because a lot of my patients ask me, hey, how about probiotics, elimination diets, supplements? And you did actually touch on this in your introduction, but how does AI analysis help clinicians determine which interventions are appropriate and which may actually worsen an individual's allergic inflammation?
Yeah, I'm really glad you bring that up because I think people have a concept that probiotics are always good for somebody and that, at worst they don't do anything, but they can't hurt. And yet we know there have been, several reported studies, case studies, or more rigorous studies that have seen that in certain populations for certain conditions, certain probiotics, may not be beneficial for somebody. We also know that there are a lot of organisms where there seems to be a sweet spot level for you. You don't want to go too low. You don't want to go too high. I mean, for example, and so taking a probiotic, if you're already at a good level, may actually push you into a negative, level with that organism. You mentioned Akkermansia earlier, and it's clearly true that low levels of Akkermansia are linked with a whole range of different diseases. At the same time, there are now dozens of studies that have observed high levels of Akkermansia in people with Parkinson's disease. And do we know whether Akkermansia is causing Parkinson's disease? We don't. But insofar as you have a normal amount of Akkermansia, personally, I would be disinclined to take additional Akkermansia because there may be a causal role. And there's one more aspect about probiotics that people don't realize is that you think that if you take a probiotic with, bifidobacterium, that you're going to add bifidobacterium to your gut. In some cases, you might, but the introduction of that bifidobacterium may be to change your microbiome in other ways, that other organisms that compete with bifidobacterium or are eaten by bifidobacterium, like they may change in the sense they may go up or they may go down. And so you actually introduce like an ecosystem shift when you take a probiotic. And so for that reason, understanding those ecosystem shifts, understanding like what normal looks like, is this person deficient? It's very difficult for physicians to do. But with the AI that Jona built, we're able to read every probiotic study and then simulate you on probiotic 1, probiotic 2, probiotic 3, probiotic 4, and knowing how those probiotics change your ecosystem from the peer-reviewed literature, we can assess whether those changes are going to be good for you or not. And I can say, like on a personal level, I used to take probiotics daily, but I actually stopped after starting Jona because I realized my gut is actually quite good, and I don't want to mess it up by taking probiotics that I don't need. And that could potentially cause a problem.
Okay, good to know. So for lifestyle medicine driven prevention, which modifiable behavior, you did mention about the diet, fiber intake. Then there's also sleep, stress, movement patterns, environmental exposure. Which of these have the strongest AI validated impact on microbiome driven immune improvement?
So we know that almost anything that you do from a lifestyle standpoint is going to impact your microbiome. So different foods, different nutrients, different supplements, but also with exercise. Aerobic exercise changes your microbiome different than a high step count, different than high intensity interval training, different than weight training. So we do know that almost every lifestyle change you make can modify your gut microbiome. Generally speaking, you're going to want to, as you pointed out, maintain a high fiber intake, avoid processed foods and ultra-processed foods. Fermented foods are always generally positive for somebody, and some level of aerobic exercise or weight training. However, that's generic advice based on population studies. For any one individual, if they're experiencing a health issue, our guts are very individualized. What's going to have the biggest impact for you really depends on analyzing your gut microbiome and running these different simulations with all these interventions to see what's going to help optimize you.
Okay, yeah. 'Cause it's never one size fits all for sure. Could AI become a clinical decision support tool, you think, for allergists, helping them stratify risk, monitor treatment response, whether, say, to immunotherapy, biologics, or identifying patients who could benefit from preventative lifestyle shifts?
100%, 100%. Um, as you probably know, there are many different drug classes which have been shown to change efficacy based on a person's pretreatment gut microbiome. So, in other words, that if we look at your gut microbiome, we can often predict for different drug classes how effective those drugs are going to be for you, and that spans a wide range, everything from immuno-oncology drugs to biologics to SSRIs and GLP-1s. That looking at a person's pretreatment microbiome predicts how effective that treatment's going to be for them. And as a result, you could even manage, so you could certainly envision the clinical support tool or clinical decision support, but also it opens up new therapeutic avenues. Possibly you should fix your microbiome so that the drugs are more effective. So maybe lifestyle becomes an adjuvant with one of these classes of drugs. So there's a whole new opportunity that we have by analyzing the gut microbiome, understanding its role in modifying therapeutics and the role it has in your health. That we really at Jona have been building for like those clinical use cases, and starting by bringing together all of what's known today.
Yeah, that's so fascinating. So, what would you say the future looks like? How would like the AI microbiome platform integrate, say, with an allergy clinic or a telemedicine model to create a preventative, personalized, dynamic approach to improving immune health?
Honestly, I think that gut microbiome testing is going to be more common than blood work, which means that it's going to be part of the assessment, both the annual assessment of an individual, as well as any diagnostic journey or treatment selection. It really seems like the gut microbiome impacts all of this so heavily, and so I think thinking to the future, I think it's going to be one of the first things that a doctor orders for a patient, just for doing any sort of assessment and treatment selection. We're not there yet, but as more and more data comes out, as the ability of AI tools grows to analyze this complex data, to pull together what's known and to establish, through clinical trials, what a diagnosis looks like for this person, how to select treatment for them optimally. I think it's going to be a very basic tool for every immunologist, but also primary care, GI, metabolic health. I think it's really going to be a core tool across the board for evaluation of a patient and treatment selection.
Yeah. Well, Dr. Grady, you've given us a lot of great information. I personally am very excited because I would love to work more in this field of microbiome to help my patients and communities and at large. I think that's really where the microbiome has the answer to a lot of preventative, a preventative pathway to a lot of these chronic diseases. So before we conclude, is there anything else you'd like to share with us?
Well, you can, if you want more information, we have a newsletter. We send out information about changes in the microbiome literature, a lot of helpful information about the gut. Obviously, you can work with us from a clinical standpoint, or even as a listener, you can order Jona yourself, and you can get this analysis and this simulation optimization plan for yourself. You can find us at www.jona.health, and we really are doing everything we can to educate clinicians and consumers about the gut microbiome, the role in health, how you can use it to analyze a person and their health, and then how you can manipulate it and change it in a way that's very personalized for you to optimize your health.
Yeah, if you could share all that information, I'll be happy to put it in the share notes. That way people know how to find you. And if they're interested in looking at lifestyle strategies that can positively impact their well-being, or even, I know none of it's like 100%, but at least to give people an idea, because there's no harm in doing lifestyle changes. There's always benefit to it, but how to optimize which type of workouts will be beneficial. I think all that would be great for our listeners. So definitely share that information. I'll put that in the share notes so people can find it easy to find you and the amazing work you're doing. So thank you, Dr. Green. Thank you for your time. And thank you to our listeners. And we hope to have you in future episodes.
Wonderful. Thank you so much. It's been fun.